This video shows a patient that has Marfan Syndrome. The result of the Marfan Syndrome, relevant to her standing, is that she doesn't have any active plantar flexion, and you see that her forefoot isn't able to push against the ground. The question would be then, could we use an orthoses or a brace to substitute for the lack of plantar flexion? This quick assessment tells us that with her dorsiflexion stabilized, with my hands in this case, but mimicking braces, she can effect a more upright stance. So we proceeded to cast, being careful to not compress the foot or distort it. In this case, because her foot has a fairly unique shape, I used a foam cushion, tried to position her foot and ankle as close to the ideal position as possible. We had chosen the Turbo with the soft liner. She has such a small foot that the extra bulk of the soft liner wasn't going to create a problem with shoe wear. This shows the day of the initial fitting. She's starting to practice for the first time weight bearing with stable ankles. You can see the difference between the left and the right. The most marked difference at the ankle is she's very dorsiflexed on the left, unbraced. On the right, the Turbo is holding her at about a 2 to 3 degree dorsiflexion angle. She has a lot of hip flexion and excess knee flexion compared to the ideal, but she's standing straighter and beginning to learn how to use the stability. She subsequently started to use the braces and worked with Kathy Shaprio, her therapist.
I think the braces have just been phenomenal for her. I've never seen a child change in that short amount of time with their walking. Since she got them, she's been able to stand much better. She still needs a little bit of support with standing, but she's taking much more weight through her legs rather than leaning on her arms a lot. She's much more willing to walk in her walker and even is beginning to walk holding on to someone's hands. It's really exciting to see what you can do with playing around with different styles of bracing with kids like this and coming up with the right one for the right child and the right time.
As an orthotist, you are involved in the initial fitting, but the true test of whether the brace is going to be successful usually is 3, 4, 5 weeks later. In this case, she has gotten better and better as she's learned to use the stability. She walks quite well. It's been a very successful project.